Assalamualaikum warahmatullahi wabarakatuh. The topic is about nursing process. This is meeting 5 topic of semester 6 of English for Nursing 3. Nursing process is a scientific method used by nurses to ensure the quality of patient care. The objectives of nursing care plan are to promote evidence-based care, to promote holistic care, to support methods such as care pathways and care bundles, to record care, and to measure care. There are 5 phases of nursing process: assessment, diagnosis, planning, implementation, and evaluation. Assessment. The components of assessment are data collection, chief complaint, history of present illness, past health history, and family history. Types of data. We have 2 types of data in the assessment: subjective data or symptom and objective data or sign. Sources of the data. Primary source is the patient, and the secondary source can be taken from the family, patient medical records, history, laboratory diagnostic test result, and medication list and literature. Methods of collecting data: interview, observation, and physical examination. Types of assessment: we have comprehensive initial assessment, focused assessment, and emergency assessment. Comprehensive initial assessment, the clue is that a detailed health history. Detailed means comprehensive. While focused assessment, the clue is that this assessment used to evaluate the status of previously identified problem and monitor for signs of new problems. The focus is on a problem area. Emergency assessment. This type of assessment is used in an emergency or a critical care situation and should be done by rapid, specific questioning of a patient while assessing and maintaining vital function. Diagnosis. We have 2 types of diagnosis: medical diagnosis and nursing diagnosis. Medical diagnosis, clinical judgment by the physician that identifies or determines a specific disease, condition, or pathological state. Nursing diagnosis, a clinical judgment about individual, family, or community responses to actual or potential health problems or life process. Components of nursing diagnosis. Number 1, problem, defining characteristic, and etiology. The clue of the problem is, this is a term or phrase, and the clue is evidence by. Defining characteristic and etiology. While defining characteristics, the clues are sign and symptom. Etiology is the causes or why the problem happened. Types of nursing diagnosis. We have actual nursing diagnosis, risk nursing diagnosis, possible nursing diagnosis, wellness nursing diagnosis, and syndrome nursing diagnosis. For actual nursing diagnosis, indicates that a problem exists. Risk nursing diagnosis indicates that the problem doesn't yet exist, but that specific risk factors are present. Possible nursing diagnosis indicates that the client's database doesn't demonstrate the defining characteristics. Wellness nursing diagnosis indicates that the healthy client has a desire to achieve a higher level of functioning in a specific area. Syndrome nursing diagnosis indicates that the diagnosis is associated with the cluster of other diagnoses. There are 2 steps of planning: planning expected outcome and planning intervention. Planning expected outcome, a detailed, specific statement describing the goals to be achieved after implementing the treatment. While planning intervention, the methods or action used to achieve the goals. Types of planning expected outcome. Initial planning. The clues is that it is done during the admission of the assessment data. Ongoing planning. The clue is you have to get new information about the client and it should be evaluated and revised. Discharge planning, the clue is what you will do and what you will the clients do or need after they have recovered. So after they go out from the hospital, you have to do discharge planning. Types of intervention: independent nursing intervention, interdependent nursing intervention, and dependent nursing intervention. The clue of independent nursing intervention: independent means freedom. You can do it your way without having to discuss with other healthcare professionals. While interdependent nursing intervention, you have to work collaboratively with other healthcare professionals. And for dependent nursing intervention, you really need an order from a doctor or physician or any other healthcare professional. Implementation. This is the fourth step in the phase of NCP. The performance of the nursing intervention identified during the planning phase involve delegations of some nursing intervention to the staff members. Evaluation determines whether the client's goals have been met successfully, partially met, or not met yet.